So, welcome everybody. It is so nice to see you all here. I am Rachel Justice, for those of you who don't know me, and along with Jillian Levinson, I co lead Woman to Woman. And this is part of our bi monthly deeper dive series. And we have a wonderful, wonderful leader for these three sessions. This is number 3 of 3, but they are all standalone and they have all been recorded for our video library. So whether you're watching this live or you're watching a recording, you can see the entire series if you'd like. And this is a deeper dive into Pilates as a tool to help with pelvic awareness. Tosh is our wonderful, intuitive, kind, knowledgeable leader for these three sessions. And we are so lucky to have you here. I am going to mute myself and I am a participant as I turn it over to her capable hands. But thank you so much, Tosh, for being here. And thank you all for joining today.
Thank you so much, Rachel. Thank you everybody for coming for the third class. I am, as Rachel mentioned, a movement teacher, and I've been teaching for the last 10 years. And I am also a mental health counseling intern. So in this series, I kind of combine the movement with a little bit of a therapy component. And today is their last class, unfortunately. And today, we're going to start our class just like we started our two first classes with two main exercises. And I've been saying that the previous classes, that if you would take away anything from this series, I would say these two first exercises would be the ones that you would want to remember and kind of maybe, be able to use it later. If nothing else sticks, this would be the two exercises that I would want you to remember. And I guess let's just go ahead and begin. One more thing before we begin. I also want to say that this is a trauma-informed class. That means that if at any point you come across an exercise that doesn't work for you today, you can always just skip it completely, take a break, or you can go back to these two first exercises that I'm going to introduce. This is going to be your default. You can always go back to if something doesn't work. All right. All right, let's go ahead and begin. I'm going to sit down on the chair because we have a lot of people who are doing it from the chairs, but the same exact variations you can do laying down on the mat. That's it. See me that way. That's it. So we're going to start with our first default exercise, which is the breathing exercise. And it's meant to engage the deepest layer of your abdominals. And by the deepest, I mean we have 4 layers of abdominals, and the deepest means the one that is closest to your back. So it's very, very in there. And in order to engage that layer, we have to take a big breath in. And then when you inhale, you're going to allow your stomach to go and inflate as much as possible. That's all good. But then when you exhale, you want to try to pull the belly all the way in towards your back. So kind of like scooping your stomach in towards the back and hold for a few seconds. And then you're going to release. Let's just do a few of those together, right? So you're going to inhale. Feel free to even put your hands on the stomach to feel the movement. Feel how the belly expands when you inhale. And then on an exhale, feel your hands come a bit closer towards your back. Now, the way to think about this is that we've all been in the situation when we're trying to wear the pants that are a little too tight, then you're trying to kind of zip that zipper. So that's the same feeling. You're just kind of trying to scoop that stomach in somewhere to close the zipper. So that's the same feeling. So again, feel how the belly goes forward and inflates on an inhale. And then on an exhale, pull that belly button in towards the back, like you're trying to close those tight bands, and hold for a few seconds. Wonderful. Let's do a couple more together. Big inhale, belly goes forward or up or to the sides anywhere. And then exhale, scoop it all the way in and hold. And let's do one more time like that. Inhale, you allow the belly to go up and out. And then on an exhale, scooping it in, holding it. Kind of might feel like you're hugging your internal organs in towards together, hold it, and then release. That's it. So that's your number one main important thing you always want to go and like fall back into if you have to. Now I want to advance it just a little bit. I see, Arlene, you have a question.
I wasn't here before. How long do you do that for? The breathing.
I would say it really is. It really depends on your needs, but it doesn't have to be long. You can go 10 repetitions.
Okay.
Let's say in the morning, in the evening, 1 minute, 5 minutes.
Thank you.
It really just depends on how much you can do that for.
Right.
Yeah. All right, so let's continue. So we're going to advance this breathing a little bit, and this time you're gonna exhale and again pull your belly button in towards the back, right? You're gonna hold those tight pants. And then the challenge would be, see if you can keep your stomach in on the next inhale. So don't allow your belly to go forward and to the side. See if you can keep it scooped all the way into the back, and then breathe to the side of the ribs. So it will look like this. I'm gonna inhale once, allow my belly to go forward. On an exhale, I'm gonna pull everything in towards my back, and I'm gonna hold it in as I'm gonna inhale to the ribs and to the lungs, really allowing my rib cage to open up, and then my stomach is still plugged in. And then exhale, I'm just gonna deflate my ribs. And again, stomach stays in. I'm still wearing those tight pants. I'm gonna inhale, opening it up the lungs to the sides, and then exhale, deflating the lungs. So the stomach stays in the whole time. Let's do 3 more times. Inhale into the bottom of the ribs, to the sides, opening the rib cage muscles as much as possible. Stomach stays plugged in. Exhale. Very good. 2 more times. Inhale, stretching the ribs to the sides, and then exhale. 1 more time. Inhale, send the ribs out, and then exhale, plug everything in, hold for a few, and then you're gonna let it go. And again, this is an advanced movement here, right? So if that doesn't make sense, feel free to just do the one that we did in the beginning, right? Where you kind of open in the stomach on the inhale and then scooping it back on the exhale. All right, and we're going to move on into the pelvic clock. And that is another exercise I would love for you to take away from this series. And I'm gonna move my camera just a bit more down so you can see my pelvis. We're gonna picture that you have a face clock sitting right here on your pelvis, just like that, flat. And I want you to imagine that that face clock, where the 12 o'clock is on the clock, is right here at the top. So it's sitting like this, right? This is the 12 o'clock. And then right here in between my legs, we're gonna have that 6 o'clock. In the middle, right where my belly button is, that is going to be the center of the clock, right? I hope that makes sense. Like this. And then from here, we're gonna turn this clock towards both directions. So first, I want you to rotate this sitting clock to your 12 o'clock. And for that, you're gonna round your back and tuck your pelvis. So then the clock kind of rounds and rotates towards this 12 o'clock position. And then you're gonna come back nice and neutral, which is your centered, where the clock is just sitting right there, like that. And then we're gonna go towards that 6 o'clock. So we're gonna tilt the clock down, arching my lower back and my pelvis forward. So the clock rotates forward as well. And then we're gonna bring it back centered. And again, you're gonna tuck the pelvis, round your lower back curve. So the clock tilts up to 12. And then you're gonna come back centered to the neutral position. And then you're gonna tilt that clock forward, arching my back, my lower back vertebrae, to get to that 6 o'clock position. I'm gonna speed it up a little bit for you so you can really see. So we go in neutral position, arching my back, back to the neutral position, and then around in my back. So we kind of rocking our pelvis forward and back, finding those and range of motion. So really going forward to 6 o'clock as much as I can, unless there's pain. And then you're going back to the neutral, and then really round in my pelvis, right? Almost like rotating my pubic bone up. That's the position, or tailbone up. And then bring it back neutral. Let's do a couple or more, going forward towards that 6 o'clock. Then just nice and tall, neutral, and then 12 o'clock round position, and then nice and neutral. One last time. You go 6 o'clock, arch in the back, tilting the pelvis, then neutral, and then 12 o'clock, or tucking your pelvis round in the back, and then coming back neutral. I find this exercise a little bit more enjoyable when you're laying down on the ground. I mean, when you're laying down on the ground, there's just a lot of gravity happening, and it always feels a little bit more satisfying. So feel free to try that laying down. You probably will notice some different feelings. All right, now we're gonna intensify this a little bit and add your whole spine to it. So we're gonna perform some sort of a cat-cow. If you ever taken a yoga class, they do a lot of cat-cows. So it involves your pelvis, and then we're gonna add the rest of the spine to it. So as I'm going to that 6 o'clock and arching my lower back, I'm also gonna push my chest forward, and I'm gonna look up. So really going into that position. Now I'm gonna come back to that neutral position, and that's a very tall spine. I'm just sitting straight. And then I'm gonna round my pelvis into 12 o'clock, and I'm gonna round my rib cage. I'm gonna drop my chin to the chest, so really the whole spine rounds. And I'm gonna come back to the neutral. And we're just gonna continue going all the way forward. I'm gonna look up. I'm gonna keep my hands up here so you can see the spine, but your hands can be anywhere, on your hands, on handles if you're sitting on a chair, down by your sides, it really doesn't matter. So you're going up, arching, and then you're rounding. So you're intensifying that position of your pelvis and using your whole spine to move your pelvis all these directions. You look up, and then you round. And you look up, and then you round. Very good. If you stopped breathing, I'm going to remind you to breathe. Good. Let's do one more time like that. And then come back to the neutral spine. You can take a little break here. So while I'm explaining the next one, you can always just, that's your time to take a break and recover your breath. So the next one is very similar, but it will hit very differently in the body just by simply opening our legs to the side. So we're gonna widen them as much as possible. If you're laying on the floor, it's the same position. The knees will go out, and you can bring your soles of the feet together like this if you're on the floor. If you're sitting, we're just gonna open the knees wide, and I'm gonna continue doing that pelvic block. So we're gonna start with just rocking our pelvis forward and back. And then see if you can really get it just in the pelvis. Don't add anything else, right? So my rib cage is kind of just there. It's neutral, right? I'm not adding it yet. I'm just rotating my pelvis forward, rotating it up. See if you can add some good breathing here to just allow your body really fall into this exercise. Take an inhale when you go forward, and then exhale round. And again, inhale, forward, exhale, round. If this is very easy for you, see if you can add that abdominal connection at the same time as you round and exhale right here. So scooping your belly in. And again, inhale, you go forward. Exhale, pulling your abdominals, wearing those tight pants, rounding the pelvis, tucking. And if this is too much, you can just stay at the rocking pelvis, not worry about the breathing. Again, forward, exhale, scoop and round. Hold one more time. Inhale forward, exhale, pull the belly, round and hold. Now, just like in the first exercise, we're going to add the whole spine to it. So wide knees, and I'm going forward, and my chest goes forward. I'm gonna look up. Just be careful with your neck position. Make sure you're not arching your neck too much. So let me show you real quick. This would be a little too much for the neck because we don't want to compress the vertebrae right here, right? In the back, in the neck. So I think more chest forward and my head is kind of following just a little bit, but not so much that I'm right here, unless that feels really good. That feels good, go for it. And then we're gonna round the spine, wide knees, and I'm gonna just drop my chin to the chest, same thing. And again, I'm going forward, I'm gonna lower my hand again. That's good. And then exhale, you're gonna round, keeping those knees wide, drop the head. Inhale, you go forward. Exhale, round the spine. Inhale, you go forward, chest forward. Exhale, round the spine. And again, if you can, add those abdominal engagements here. So inhale, belly goes forward. Exhale, scoop in your belly all the way in towards the spine and round it. Inhale, I go to that 6 o'clock position. Exhale, pulling my dumbbells in, wearing tight bands, and round it. One more time. Inhale, we go forward. Exhale, closing everything into right here. So it kind of looks like a scoop almost. And I'm gonna release and come to that neutral position. Wonderful. You're taking your break as I'm gonna explain the next portion of the movement. So let's see, we're gonna go ahead and take our fist and we're gonna place that fist right in between our thighs. You can choose where it is. It can be a little bit closer to the knees or a little bit closer to your thighs, whatever feels best. I'm gonna place it there. And I'm gonna go back to the same breathing. So we wanna engage our deepest layer of abdominals, and then we're gonna add a little squeeze with our legs. So that will help us really get into that pelvic floor muscle connection. So you're gonna take big breath in again. Remember, allowing the belly go forward, or if you advance, keeping it in already. And then exhale, really scooping the stomach in. And this time you're gonna add a squeeze with your legs. So you scoop in and squeeze in your legs. You're gonna hold for 3, for 2, for 1. You're gonna release everything. And we go again. Big inhale. Change my hand. Exhale. Scoop the belly, squeeze the fist, and then hold it. 2, 3, release everything. Very nice. Let's do 3 more times. Big inhale. Belly goes forward. Exhale. Scoop the belly, squeeze the fist. 2, 3, release. Very good. If you're feeling advanced, you're gonna take a breath in. Exhale, scoop the belly, squeeze the fist, and then you're gonna keep that belly in. You're not gonna let it go forward on the next inhale. I'm gonna do that with you. I'm gonna keep it in, and I'm gonna inhale into my ribs. And then exhale, scoop even deeper. Squeeze the fist even deeper. Hold. 2, 3. Let's do 1 more time. I'm gonna inhale into the ribs. Inhale. Exhale, pull the abdominals. Deeper, squeeze the fist. 2, 3, release everything. Very good. Make sure you really allow the body to kind of relax in these breaks, right? So you're not holding on any tension anywhere while we transition into another portion. As you relax, and you can also move in any way that works for you. So if you want to just kind of stretch your neck in any way, if that works, maybe down, maybe up, or whatever, maybe move your hips a little bit, whatever works.
And Tosh, you have a hand raised.
Yes, hi.
I was just wondering, that last exercise that you showed us, I was still squeezing between my legs with my fist. Do I release that at some point through each of the repetitions?
Yes, indeed. You want to hold it for just a few seconds, and then you definitely want to release completely.
Okay, thank you.
Yeah, the belly would be the only muscle that will be working throughout the whole thing. And again, that's a kind of like an advanced thing. You don't have to do it yet. If it feels uncomfortable, if you feel like you're not sure what you do, and you can always just inhale and allow the belly to go forward, and then exhale, connect to it. Right. So we're gonna add a little extra to this whole thing, right? So the belly, I hope that kind of makes sense, right? You're either letting it go or you're holding it in the whole time, but only during the exercise. And then we're gonna add a little extra movement here. So the fist, the stomach, and then on the next let me just show you. I'm gonna go inhale and belly goes forward. Exhale, we're gonna scoop the stomach in, squeeze the fist, and now I'm gonna move my right knee forward. I'm gonna bring it back. We'll do the same with the left knee. Please feel free to tell me if it's hard to see. Inhale, belly goes forward. Exhale, pulling the belly in, squeezing my fist, and my left knee goes forward. And I'm gonna bring it back. And again, exhale, right knee forward. So I'm kind of moving my pelvis forward. And then center, and then the left knee forward. This is what it looks like when I'm facing you. I'm kind of moving my front hip bones, one forward, then the other one forward. And this is what it looks like from this side. So let's do a few of those together. This goes in between my thighs. Take a big breath in. Exhale. Connect to the stomach muscles. My right knee goes forward. And again, exhale. Left knee goes forward. Make sure to squeeze the fist the whole time. Exhale. My right knee goes forward. And exhale. My left knee goes forward. Very good. One more time. Inhale. Exhale. Right knee. And back in. Exhale. Left knee. Come back in. That's it. Let it go. Take a few seconds. If that felt good, you can always do this movement without the fists. So the fist is just an addition. So this can always, I find it feels so good in my hips. Kind of really opens up all the muscles around the lower back. So you can always just do that without too much of a strength component. Okay. And then the next portion, we're going to add, actually, no, guys, I'm changing my mind. I'm looking at the time. Let's move on to the next exercise. And this one is going to look also quite interesting. So I'm going to have to find an angle to show you this. I think a better angle would be if I'll be facing you with my butt towards you. So there you go, something like this. So you're gonna come to the side of your chair. There you go. And what you want is for one butt cheek to stay on the chair, and your other butt cheek is kind of to be on the, like, off the chair, if that makes sense. So see if you can find that position on your chair. Kind of allowing that one butt to hang down a little bit. Yeah, good. And then from here, you're gonna take, you're just sitting kind of evenly, but then on your exhale, you're gonna allow this butt to drop down as much as possible. See how I'm kind of lowering the hip down? And then you're gonna bring it back center. And again, I'm gonna take a big breath in. Exhale. Slide that butt cheek down as low as it goes, as low as it feels good. You might feel a lot of pull and a stretch, which is what we want. And again, big inhale. Exhale, sliding the butt down. Bringing it back. I'm going to turn sideways so you can see it this way. Again, I'm going to take a breath. Exhale, bringing my hip down. So I'm really kind of like falling off the chair a little bit, feeling a lot of pull right here. And I'm going to bring it back center. Let's do 2 more times. Inhale. Yep, I see a comment. I feel that so relaxing. Yes, exactly. I'm so glad. That's exactly the point. So you really get in that, finding the place that feels good for you. If it feels good, feel free to even stay there for longer than I am, right? For the purpose of the class, I'm going to continue moving. But if that feels good, please feel free to stay there for a little bit. So that's the movement. We're going to do 2 more times. Inhale, exhale, and one last time. Inhale, exhale. Good. Bring yourself center, and we have to even ourselves out. So we're going to go into the other butt cheek. Let's see. So I have to come sideways to the chair. Find a place where I feel stable, and the butt cheek is hanging off that chair. Let's go for it. Big inhale, exhale, Drop that other one down. Oh, that's a good stretch. Breathe that up. Exhale. Good. Inhale. Again, feel free to scoop your abdominals in lightly in this exercise as well. It's always a good habit. Exhale. Rotating just in case. Exhale. Back. Let's do 2 more times. Inhale. Exhale. And one last time. Inhale. Exhale. That's wonderful. Back to you facing. And now we are going to address the upper body. Very underestimated and important component of pelvic floor health is the whole posture and the upper body. So we're going to start with a simple arm circles, but simple, not so simple. So you're gonna bring your hands all the way up into the ears, and I want you to really reach them, stretch them. Feel free to lift your chin a little bit if that feels good, like all the way up, like you're stretching in the morning, and then just drop the arms down. And again, big inhale, exhale, reach the arms up, nice and out, and then lower back down. Very good. One more time. So we kind of reaching our arms up with a lot of purpose, right? Like we're really getting that stretch the whole front of the body when you lift the arms, and lower them down. Now we're going to do the same thing, but with the arms to the side. So I'm going to take a breath in. I'm going to exhale, pull my belly slightly in, and I'm going to reach my arms out so wide, like I'm trying to touch 2 different walls at the same time. And I'm going to release. Another visual I'm going to give you here, imagine that you have a thread attached from one collarbone, which is right here, to another part of your collarbone, which is right here. And right now, I'm sitting just a little bit like relaxed, and the thread is kind of hanging. And what I want to do is to tighten that thread. So I'm going to lift my chest up. I'm going to reach my arms out to really get that thread as tight as possible, keeping this line very straight. And I'm going to reach and try to touch 2 different walls. That's a lot of purpose. And I'm going to lower back down. Let's do that 2 more times. Inhale. Exhale. Tighten the thread. Reach the arms out. If I were there in person and I would come to you and try to lower your arm, I shouldn't be able to do that. So it's a strong arm. I can't lower it. It's very, very muscly and reaching 2 different ways. And you're going to relax. 1 more time. Inhale. Exhale. Reach, 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 and stretch. Jab. And lower back down. So now we're going to combine these 2 movements with a lot of purpose and make it into a full arm circle. So we're going to start with the arms lifting up into the ceiling as high as you can, and then you're going to reach them out like you're trying to touch the corners of the ceiling. Then you're reaching out to the sides like we were just doing, touching 2 different walls all the way out, keeping the collarbone wide, and then lowering my arms all the way to the hips. So very purposeful circles. And again, lift up, reach to the corners of the ceiling, then out to the walls, and then all the way down. Very good. Inhale here. Exhale. Reach and stretch and stretch and stretch and stretch. Good job. Bring it back down. Wonderful. 2 more times. Inhale. Exhale. Lift and circle. Amazing. 1 more time, this direction. Inhale, exhale, lift, circle out, all the way out, and lower the arms down. I find that in my practice, I found that when you do exercises with that much purpose, just 5 repetitions, sometimes, not sometimes, but every time, does more for you than you would do 30 without any tension, right? Just like kind of circling, not really thinking about it. So less is more. let's go ahead and reverse those circles. You're gonna start with the arms down. You're gonna take a big breath in. Exhale, stomach comes into my back. I'm gonna stretch those arms out to the sides and then up to the corners and then lift them all the way to the ceiling, reaching my spine up as well. And then I'm gonna lower them down by my sides. 4 more. Inhale, exhale, reach out, up and down. 3, reach out, up and down. 2 more times, all just for flashing my stomach here, stretch out, up and lift and lower. Time, inhale, exhale, out, up and lower. Very good. The next portion here is going to be the elbow lift. So what I want for you to think is, you're gonna, one hand can be on the chair on the handle or down on the chair, doesn't matter. And the other one's just like that behind my head with the elbow very wide. So I'm not here, right? I'm not closed in. I'm really open, pushing my elbow back as much as possible. I stay facing this way. And then from here, with the same amount of purpose, I want you to think that you have a balloon attached to the top of the elbow. And that balloon is flying out into the sky. So it's lifting up and it's pulling my elbow up with it. I'm being pulled up and I'm also side bending at the same time. So really reaching and stretching this whole side of my ribs, armpit, elbow. And I'm gonna come back center. Take a big breath in, exhale. Abdominals in, and my elbows being pulled out by that invisible balloon, the very strong balloon, maybe many balloons. And then you're gonna come back center. One more time, inhale, exhale, lift, stretch, up, 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 up. Make sure you're still looking centered. And then you're gonna come out. Good, hold that arm down, we go on the other hand, right behind my hand. The balloon is attached to the top of the elbow. I'm gonna take a big breath in, exhale, and I'm being pulled into the side bend and up, very important. So I'm not just falling down, right? I am side bending and lifting that elbow as high as I can. And then lower back down. 2 more times, inhale, exhale, lift, 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 lift. Good, come back center, 1 more time, inhale, exhale, lift, lift, easy. Come out of it, put the arms down, and then from here, we're going into the torso twists. So your hands can be really in any position. Nothing specific here. All we're gonna do is twist the torso one way, and come back center, twist the torso the other way. So the arms are really what feels good. Some people just prefer like that. Some people prefer like that. Some people prefer like that, right? So really it's up to you. Whatever helps you kind of get into that twist a little bit more. As you twist in, I wanna encourage you to make sure that your hips are staying centered. So I'm not twisting my chest and my hips, right? My hips are staying facing exactly forward as I'm just turning my chest. So it's like I'm rotating my ribs on top of my hips, really making sure the pelvis is stable. That's good. Let's do it just a few more times. Really open up the ribs. Good job. And then we're gonna lower everything down. Take a nice good recovery breath. And then we're gonna add a bigger circle with our torsos. I'm gonna start slow. So first is very similar to the cat-cow we did in the beginning. So you're gonna bring your whole weight forward, just like that. Feel free to arch the back too. All of that is fine. So really just shifting my weight. I'm gonna put my hands on my knees because that helps me to get even more forward. And from this position, I'm gonna shift my whole weight to one side. Nice. And then from this side, I'm gonna shift my whole weight back and kind of round my back. And then from this position, I'm gonna shift my weight to the other side. So if I speed it up for you, I'm gonna come forward, one side, back, the other side. So really just this enormous circle with your whole torso around the legs. The pelvis is involved. You're allowing your back to round and then to arch. So just like we were doing our cat-cows and the pelvic clock exercise, right? Everything is moving in your body, doing these big wide circles. If the circle doesn't quite happen for you, feel free to just continue going with the weight shifts, right? Just forward, back, the other side. Forward, side, back. Now, let's go ahead and reverse that. We can go the other way and see how that feels. Seems like a very small adjustment, but usually we find a lot of interesting things when we just simply switch direction like that. Bring it forward, bring it down, and then really try to add good breathing to this, right? Don't hold your breath. That's like the main rule. So you want to take a breath in and exhale. Feel free to even add your head to this as well. When you round, you can nod your chin, you can look up, really allowing your whole body to loosen up and move. Jab one last time. And then I'm going to pause and step back in the center. We are going to finish with just a few stretches. So first one is going to be the figure 4 stretch. So very important to loosen up the muscles around the lower back and the butt when we're dealing with this area. So what you want to do is to bring the leg on top of your knee. I'm going to lower my leg, my camera, like so. If this feels impossible, you're going to take the leg and just pull it in towards your chest, like so. Your knee can be up here. For some of you, the knee can be all the way down here. The goal is to be this way, as long.
You have a comment in the chat.
Yes, clenching the butt when you're doing the around movement is very common. And I would encourage you to not do that. But it's okay to do that because your body is trying to figure it out a new movement. So it's trying to just kind of use all the muscles available. And it's okay if that happens. Not a big deal, but see if you can kind of relax the body and just move, like kind of moving your joints and the muscles without really clenching much. I hope that answered that. Okay, going back with the stretch. So the leg up. So again, this is the goal. The knee is like this, parallel to the floor. If that's not feasible, the knee can be up, it can be all the way up here, or you can just simply hold the leg in towards your chest like this. I encourage you to bring it up, and you're just gonna stay there and breathe. That's all we want. We want the gravity to take that knee a little bit lower to the floor. So you're just taking a few breaths here. Maybe even helping it just a tiny bit, bringing it down just a little bit, only to the place where it feels good, it feels okay. I'm gonna turn sideways so you can see this as well. Another thing you can do here, if this feels totally normal, you feel the stretch, you could take even more, feel free to shift your weight forward. You will feel it a lot more all in this area. I'm just gonna hold for a few more seconds. And I'm gonna come off and I'm gonna do the same thing with my other leg. So I'm bringing it up on top of my other thigh. And I'm just allowing the gravity to take place here. Take an inhale, turn this way for you so you can see, and exhale. Again, if it feels very doable, feel free to shift your weight forward. To kind of add, intensify that stretch a little bit. Just hold for a few seconds. Feel a deep stretch all around you. And you're going to take it down. Feel free to do 3 of those, holding from 10 to 30 seconds. And then the last thing we're going to do here is we're going to stretch the psoas muscle, which is so important, especially if you spend a lot of time in the chair. So I want you to bring your knee down. So you're actually gonna drop one knee down. So just like this. So I'm dropping it down. And here you already might notice a little pull on the knee or on your thigh. If that's plenty, you can just stay here. If you're ready to take a little more, you're gonna lift that same hand of the knee that went down, and you're gonna side bend towards this other knee that is still bent. We're gonna side bend. I want you to see if you can find the tension and the stretch all the way in your thigh, maybe even in your belly, maybe even goes all the way up here. You might feel this whole connection here. If you're ready to take more, so my leg is down, I'm in the side bend. See if you can move your body weight back, like so. And this will add you even more of that tension right here in the whole front of the body. And you're just gonna stay there. If you have a back of the chair, you can even lean into it. And I'm gonna come out and do the same on the other side. So first I'm dropping my leg, I'm dropping my knee down. And for some of you, that might be it, that might be enough. If you want a little more, the same hand of the drop knee, I'm gonna lift up and side bend. That's good. And if you're ready to take more, you're gonna shift that weight back so you really feel this whole tension right here in the front, in my chest, in my armpit, even all the way down to the belly, all the way down to my thigh and my knee. I'm gonna stay in these just for a few seconds. Out of that one. And we pretty much did it all. I want you to just center yourself for a few seconds before we finish the class. Feel free to kind of lower your gaze down or even close your eyes if that feels good. Just take 3 good deep breaths. Inhale, and then exhale and releasing whatever tension that you might have acquired accidentally through the class. Or if there's something still working, like Cynthia was mentioning, like something might have been clenching somewhere. So just take another breath in. And then the exhale, just make sure you relax all the muscles. And do that one more time. Inhale. And exhale. Relax. I'm gonna call it a day. I'm gonna call it done. Good job, everybody.
Thank you so much, Tash. That is really, it is difficult, and it's those really small movements that get to you. It's wonderful. Does anyone have any questions or comments? I know some of you it was your first time, some of you are repeat customers.
I have a comment. I think that, thank you so much. I think this is just really great. I'm so happy to hear that you're pursuing mental health, right? Mental psychology, and also body work. Yay! Yeah, yeah.
Thank you so much. That
Yes.
means a lot. And yes,
Yes.
I agree with you. It's something
It's so
very
important.
special. Yes.
Well, the mind body, the connection.
Tosh is actually in graduate school for mental health as well, to supplement,
Yes,
sort of complement the work that she's doing. So,
right.
so perfect that you're mentioning, you know, that kind of this mind body connection and ideally,
Yes.
you know,
So important.
exactly. So that's
Thank you.
My
Just
pleasure.
want to second and third that. Thank you. It was really wonderful. And I also know that body-mind connection is it all. I mean, it's not it's
Everything.
a minor thing. It's the thing that
Yes.
we to come to integrate to be well.
You're getting comments in the chat. Excellent. Thank you. Oh, and someone has a hand raised.
So I thank you so much. I was late today, but the work that you're doing makes me feel so much healthier and more energetic. So thank you.
Thank you,
Very.
Joanne.
Yes.
Thank you.
Thank you all so much. Most importantly, a huge thank you to Tash. This was really, the past 3 sessions have been wonderful. We've received such positive feedback. I think this is so necessary. You know, again, so much of the programming that we offer through Woman to Woman is kind of, you know, educational and supportive, and doesn't, it is not experiential in this way. And there's clearly a real need for this. So thank you, thank you, thank you. And I know we will be continuing the relationship individually and, you know, through our community. So thank you all for being here. Have a wonderful afternoon, feeling energized, feeling empowered, and feeling motivated to tackle this heat that lies ahead. It was a pleasure.
Thank you, Rachel.
Bye, everybody. Thank you.
Bye.
Bye.
Thank you.